Joining us for this week's Your Health segment are Dr. Christopher Welsh, Associate Professor of Psychiatry at the University of Maryland School of Medicine and Medical Director of the University of Maryland Medical Center's Substance Abuse Consultation Service. Also with us is Donna Jacobs, Senior Vice President of the University of Maryland Medical System. Thanks to both of you for being with us.
Thanks for having us.
Doctor, you've been in addiction medicine for 2 decades. What are you seeing now?
Seeing pretty much the worst that we've ever had. Certainly in the Baltimore area, which we've had heroin for decades. More problems with it, more overdoses, more overdose deaths, and the rest of the state. I mean, we've had more opiates even starting in the 90s in suburban and even rural areas in Maryland. A lot of other parts of the country really didn't see it until the last decade, but certainly those numbers all over the state, but certainly here in Baltimore, really bad.
Your folks sent over this chart, which is going to be hard to see on TV, but you can plainly see 2 lines just taking off in the last year or two. Those 2 lines are heroin and fentanyl. What's happening with those substances?
So just so people are aware, because fentanyl is a very good pain medication, but that fentanyl, almost all of it is illicitly manufactured, most of it in China. It's being brought into the country and then either included with heroin, or sometimes people are buying and there's no heroin, it's all fentanyl. And fentanyl is much more potent than typical heroin you would buy on the street. So someone who's used to whatever amount of heroin they're using, they use that same amount of pure fentanyl and they overdose.
I've heard that one of the things that's happening with this wave of fentanyl coming into the country is that, it's supply and demand. There's so much of it that it's gotten cheap on the street, and a high that used to cost somebody 15 or 20 is now 5 or 10. Maybe they're taking more, and maybe that's why we see the fatal overdoses.
Yeah, it's not knowing what you're getting. It's even, we've seen people at university in the emergency room who don't use opiates. They only smoke marijuana. We're finding fentanyl in marijuana now. It's in with cocaine. So people that wouldn't even ever use opiates are coming in overdose because it's in the different drugs that they're using.
All right, we'll talk more about the medical side of this, but the medical institution is also, Donna, working on a community response. What do you have in mind?
Well, we started a program in June on mental health and addiction. It's a community conversation where people could come in and get answers, to speak with physicians and have a real dialogue. That's what it is. It's not an academic program. And it was so successful, and there were many topics that we presented that time. And people asked us, what are you going to do in the future? So we decided to unbundle it, unpackage it, and do one topic at a time.
If you have a question about opioid addiction, defeating that on an individual basis, also a community basis, give us a call. We'll have the number up on the screen. You can also tweet your questions. The Twitter address is @MPT News. Doctor, is there anything from a community standpoint that you want people to understand better? Any misconceptions, any message that really needs to get out?
Well, I think, and people, we've been in this epidemic now for a few years, so I think people are aware, but just to remind people that there really are no boundaries. This is hitting across the socioeconomic spectrum, all over the state. We're seeing heroin, which for many decades had been largely an inner city, poor, minority thing. Now we're seeing much more out in the suburbs and rural areas.
And there's some sensitivity to that. I mean, it's not a medical issue, but some feeling in the community that more attention is being paid now that it's no longer just an urban thing. I mean, the numbers point to it being just a spectacular problem everywhere, but you're treating it from a statewide perspective.
Well, from the numbers perspective, between 2015 and 2016, there was a 66% growth rate in the number of overdoses in the state of Maryland. So you can see you showed that chart, but you can see the dramatic increase all across all of our communities.
Yeah, no question it's a problem. Let's talk to Ed in Cecil County. Ed, thanks for calling. Go ahead.
Why aren't these doctors who distributed massive amounts of opioids and the big pharma that got them involved in that going to jail?
Thank you very much. Do you blame Big Pharma for this?
Well, I think there are a lot of sources of the problem, but certainly back even in the 80s, we started treating pain more aggressively. In the 90s, and Purdue, that one of the biggest manufacturers then, really did push, and I think didn't kind of represent all of the issues that they were aware of at the time. But it's also partly a much larger societal issue that here in the U.S. we have come to expect that your pain is treated in a certain way. So I think now everyone needs to change. The physicians and...
What's good medical practice right now? We happen to have a member of our team sitting in the control room, shoulder in a sling after rotator cuff surgery, with some minimal, opioid, the stuff that's mixed with Tylenol. Is that still a prudent thing to do? Because hearing all this, many people are scared of it.
Yeah, well, I think the biggest thing now is that it's a multimodal treatment of pain, so that opiates may or may not be a part, certainly more using ibuprofen and other things like that, but much more focus needs to be on other things, physical therapy, just relaxation and kind of more mindfulness around how you think about pain and experience it. So that's what really, there's a big push now in educating physicians and medical students that we can't just treat pain. We have for the last few decades with mostly opioids. So we really need to look at it as a multimodal treatment.
As you might imagine, it's a big policy issue, and it's an issue that the legislature focused on quite a lot this past session, the HOPE Act and a number of other measures. But one of the requirements is that doctors prescribe the lowest dose of opioids necessary in order to get a patient through.
And for a shorter period.
For a shorter period of time, right. And also look at the general registry on what medications the patient may be on.
Let's take a call from the Eastern Shore, Somerset County. This is Kathy. Kathy, thank you for the call. Go ahead.
Hi, I was just wondering, is there any correlation between childhood sexual abuse and people that have come into opioid abuse?
Kathy, thanks very much. In response to other types of trauma than pain.
Yeah, there's certainly a high amount of many different psychiatric issues that correlate with addiction, but certainly childhood and other abuse. We see sexual, physical, even certainly in Baltimore City and growing in the suburban and rural areas, just the traumas related to certainly in Baltimore the high gun violence or murder rate is mostly related to the drug trade, and so a lot of people are losing family members, losing friends to overdoses, to the drug trade, and so trauma at various points in someone's life really does contribute.
Let's focus on treatment for a minute. Donna, I want to ask you about availability across the system, across the state, but in your experience, doctor, what works to get somebody out of this addiction?
I mean, a lot of things. If someone can get out of, again, in Baltimore City, so many people live in just terrible neighborhoods. So it'd be great if everyone could get out to a nicer area, but many can't. A lot of evidence for the use of medications. So methadone, Suboxone, naltrexone are the 3 FDA-approved medications in the U.S.
By themselves or with some other sort of talk therapy?
Yeah, generally they're done in the context of counseling, could be group, individual, but there are also, there are primary care physicians who can prescribe buprenorphine. And someone may just have the counseling when they meet with them. They may go to Narcotics Anonymous meetings. So a lot of different ways, but and not saying that everyone needs to be on medication, but there's, I think, throughout society a a large stigma against the medications, and I think it's important that people realize that, especially for opiate addiction, that they're really proven to be helpful.
Ms. Jacobson, where do we stand on availability? I mean, the problem has been just exploding. Has treatment been able to keep up?
Well, within our system and many of the other hospitals in the state, all of the services that Dr. Welsh spoke about are available at the hospital. But we also want to make sure that we're educating primary care physicians on the many remedies that they can offer to patients when they need assistance. And that's, again, a dialogue that's important between experts in the field, psychiatrists, and those who really specialize in substance abuse, and those in the community who may see patients for any number of things.
Let's take a call from Baltimore County. This is Kitty. Kitty, thank you for the call. Go ahead.
I just wonder why the hospitals are prescribing so much of the opioids. Somebody told me they got a bottle full practically, and they took 2 of them. And also that why aren't they prescribing marijuana? Medical marijuana, evidently, as I understand it, and I'm no doctor, does as well and better than the opioids.
Kitty, 2 good questions. Thank you very much. First off, the medical marijuana isn't quite out there, but your views on that. And is there any evidence that the medical community as a whole is writing prescriptions for lower doses and shorter periods?
Yeah, we definitely know nationwide and certainly here in Maryland that we've significantly reduced the amounts of opiates that we're prescribing. Now the state medical assistants, there's a limit, and you have to get special authorization to prescribe over a certain amount per day. So there really have been efforts to significantly cut down that.
Right. Exactly.
As far as the medical marijuana, so Maryland, it will be here very soon. It's a difficult situation because at the federal level, it's still an illegal way to use marijuana, but states that have had medical and states that have decriminalized have definitely seen reductions in opiate overdose. Seems that people are using it more to treat their pain and less opioids. So, I mean, right now we don't know if it's a causal, but certainly there are states that have seen that correlation in reduced opiate overdoses when they have more marijuana.
But as Dr. Welsh says, in the meantime, because of the federal restrictions, hospitals, physicians are a little bit leery to move forward, even if the state says yes, fearing liability, prosecution.
Interesting stuff. Let's take a call from Carroll County. This is Steve. Steve, thank you for the call. Go ahead.
Yes, my question is, what's being done on a corporate scale to limit the production of pharmaceutical drugs? My reading suggests to me that the top 3 pharmaceutical companies last year made hundreds of billions of dollars in profits, and a lot of it are from these very drugs that people are getting addicted to.
Thank you very much. Yeah, is it a top-down or bottom-up approach to limiting the number of prescriptions?
Well, it really needs to be both, but certainly at the top, there are more efforts. The DEA is putting in limitations on how much can be produced of different opioids. There's much more, scrutiny of what's going on with the big opioid-producing companies. So certainly, what we can do as clinicians and, at our level, we definitely want to do from, I guess, the bottom up. But I think the federal government really is looking at the top as well now.
Let's squeeze in one more phone call. Washington County, this is Jesse. Jesse, you're on MPT. Go ahead.
Yeah, I want to know if you noticed a difference between years ago, there wasn't a lot of help for people suffering from opioid addiction. And, the outcome to somebody who was addicted to drugs was going to prison. And, the judges would say, well, you got a drug problem. And drug addicts would say, well, I need programs. I need this. And they say, well, we got your programs. They're in the state penal institution.
Jesse, thank you very much for the phone call. Certainly your profession has changed a bit.
Yeah, certainly, there's much more treatment, but we also are trying some innovative things that in Baltimore, we right now have a program called LEAP. It's Law Enforcement Assisted or LEAD, law enforcement assisted diversion. So people that would have been picked up on minor drug charges are now being picked up and instead diverted into the treatment system. So that's being piloted now in West Baltimore, and the hope is to be able to fold that out to other areas of the state.
Donna Jacobs, Dr. Welsh, thank you very much.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.